So, how has your experience been with regard to the effectiveness of carbetocin versus oxytocin for the prevention of postpartum hemorrhage?
Let me tell you, much before carbetocin came, we knew there was a drug that was coming. People were all awaiting this drug because all of you all know that oxytocin should be refrigerated if it has got to maintain its potency. It has been recommended by the WHO for the management of third stage of labor, the oxytocin, for years. But the only problem with that drug is that unless you refrigerate it in 2 to 8 degrees centigrade temperature, it loses its potency. And many times, especially in the low resource settings, it's not always possible to get that kind of a temperature because you do not have refrigeration. And so many times oxytocin may not be effective. So in that instance, I would say that carbetocin is very effective. Now, when you come to ask me my experience with the drug, I would say that yes, we have been using it for some time now. And it is a very good drug. I would say, is it in any way lesser potent than oxytocin? No, because it has got about the same potency of oxytocin, and it has been used in the management of active management of third stage of labor in order to prevent postpartum hemorrhage. Probably that's where exactly its role is in. And the best part of the drug is that its action is very immediate, and then you find that its action lasts longer. So you've got a sustained contraction of the uterus, and so that helps a long way because, as all of you all know, oxytocin, to get that effect, you will have to repeat its dose. Here with a single dose, which you give either IM or IV, normally we give 100 micrograms IM, so that when we give it as IM, its action lasts for about 2 hours. When we give it as IV, we give it as a slow IV for 1 minute, within 1 minute, and you find its effect lasts for about 60 minutes, so for an hour or so. So I think it is a very good drug in the prevention of postpartum hemorrhage. And we have also found it as effective as oxytocin. It is in no way less than oxytocin.
And how has your experience been with the use of carbetocin in vaginal deliveries?
Yeah. See, many people were promoting carbetocin, the use of cesarean section, third stage, like how we do it for the vaginal delivery. But we find it is equally potent, it's equally effective in a vaginal delivery. And I would advocate that we actually use it for most of our vaginal deliveries. We have got no issues about using it in vaginal deliveries. And as I rightly told you all, you should give it just as how you give oxytocin at the time of delivery of the anterior shoulder, or within 1 minute of delivery of the baby. You give the carbetocin, and you can give it IM or IV. If you've got an IV access, give it IV. But remember to give it as a slow IV. If you're giving it intramuscular, of course, no issues at all. The action of intramuscular, as I told you all earlier, is a little long. It acts for about 2 hours or so. And when you give it as IV, it lasts for about 60 minutes. So it is as effective in a vaginal delivery as it is found in a cesarean section.
Doctor, would you recommend the use of carbetocin for the prevention of postpartum hemorrhage in every delivery?
I would recommend it for any and every delivery. It really doesn't matter so much. As all of you all know, in the presence of hypertension, we don't give methogen. In the presence of a heart disease, we don't give methogen. But there's absolutely no issues. You can give it in both the conditions of hypertension and in heart disease. There is no problem at all. But I just want to reiterate one important thing, that this is useful for the prevention of postpartum hemorrhage. We have not studied its effectiveness in the treatment of established postpartum.